Hey guys, this is Dr. Lamb talking about HALLUX Limitus. We're going to go over a live case later on, but I just want to give you a little background of HALLUX Limitus. HALLUX Limitus, or AKA big toe joint arthritis, sometimes people come in and confuse that with a bunion. Okay, this foot model is a bunion, but HALLUX Limitus is what we call a dorsal bunion, or you get this bunion, this bump on top of the big toe joint. It can also be gout, but we can figure that out really easily with an x-ray. So let's talk about HALLUX Limitus / rigidus today in this video. Again, we'll show a live case and show, we're able to now make a small low incision on top. I'm going to show you on top, small low incision. You'll see a live case. Basically make a small low incision on top, right about here. That's the big toe joint, as you can see. I'm going to work backwards here. Pretty much I stick a rotating burr that protects the tendon and the nerve, only cuts bone, no soft tissue. Soft tissue is well protected. So make a small little stab incision, put this burr in there, and just pretty much just burr down the spur. Basically just cut down the spur, as you'll see. Okay, this is Dr. Lamb again, coming to you from one of the rooms where we talk about HALLUX Limitus. We're gonna go right here, HALLUX rigidus. Make a small little incision in the skin, put the burr down here, and just burr this down. Sometimes reach over and burr this down a little bit too. And you'll see before and after. The rigidus is very painful because it's jamming right about here. The joint is jamming. So traditionally, we would open it up, shave it down this way, and you still cause a lot of stiffness. So what did we do? Didn't really help very much, right? So now we're able to do it minimally invasively and able to burr this down without opening up the joint. And that seemed to get better results. We're not exposing the bone. We're not exposing the air. And patients heal with one stitch. They're walking on it right away. No wound healing complications, and patients get back to activity almost right away, depending on how bad your spur is. Now, if it's really bad, the stage of the HALLUX Limitus, obviously the very severe cases, the joint fusion is still the best choice. But we pushed the limit on this before. I've had patients who say, Doc, I don't care. I know you tell me that I need a fusion or an implant, but I would like to try the minimally invasive chilectomy. Well, this case will show one of those cases. Enjoy. HALLUX rigidus right here, big bump on top. Right here, the whole joint is inflamed, it's locked, and there's really not much motion. End range of motion is right about here. It's locked. So the bones were right here. So we're going to try to get rid of this with the minimally invasive method. We're going to look from here at this side. Again, you see that locking mechanism right there causing a lot of pain. The goal is to go ahead and shave this bunch off with a small little incision, so that the joint can at least move up to about 90 degrees today. That's my goal today, is get up to 90 degrees with the MIS method. Let's take a look. You want to move your toe around? Take a shot. Live. finish off right here. Finish off here. See? Smooth it out finally. And that's what we have. Let's pull out the bone paste. All that bone paste out of the bone. Okay, let's check. Yes, that's all the bone paste, that's all the bone paste. Now let's watch the range of motion now. We had a big spur right here before on both sides. Now, motion. Motion is great. Checking the motion right here. Check out the motion from the side. Range of motion. Pushing that motion all the way up. Range of motion all the way up.